Hello, everyone. Hello. It is happy Thursday. I'm glad to be on with you today. And let me get my banner so we can be ready while we're waiting for our guests. So, if you'd like to be a part of this awesome platform, it's bit.ly stream for you, and you can join me live as well. I'd love to have you, and so would our guests, if you are available right now. So I'm going to give you the opportunity to invite people to join in. That's the wrong phone. All right, I see it. Now let me share while we're waiting for our guests. My name is Angela McGowan. I'm your professional healthcare advocate, caregiver strategist, and author and publisher of the book, How to Get Out of the Hospital Alive. And I'm excited about what we're going to be talking about today. So, as I said, I'm waiting for my guest. I know that this is a new platform for her, so we're going to wait and see if we can locate her. I think when she sees I'm sharing, maybe she'll see that we are on live. So let's give me a few minutes just to see if I can get with her. Oh, I see myself live. Okay, awesome. So that's a good thing. Just bring it on live on multiple places, and then she'll be able to see as well. And I hope that will indeed help so that we can talk about the subject today, and that is about the heart as well as pre-diabetes and diabetes. So I just want to see if everybody could see me. Okay, I'm from a different area, so I'm trying to get the light right, but it looks like it might be too light. So I'm just going to step away for a second to see if I can get this right. Hold on. Let's see if I can adjust that a little bit. I'm hoping this will work out okay. Okay, I think that's better because I had like a glare in my face. So, all right. So I don't know if she is on yet, but I'm going to just look and see what we have going on. She'll be able to see as well. Let me turn that down so we won't hear my background. Well, let me see if I can reach her a messenger and see if it's going on. Look at that, so I'm a little bit behind. Let me see. Okay. So it is 3 p.m. Pacific, and it should be 5 o'clock Central Standard Time. So I'm hoping that is what's going to go on. But we're going to start oh, wait, I see a comment. It could be her. Let's see. There she is saying, hey, Angie. Okay, so you need to come in. Hey, Trinette, you need to come in with me. Let me put up so you can see where, okay, this right here. Oh, it looks like, it is 3 Pacific, and it should be Central Standard Time. So I'm hoping you have to turn me down. I think we're going to start. Oh, I see a comment. It could be her. Let's see. There she is saying, hey, Angie. Okay, so okay, I'm gonna let her turn hers down so we won't get the feedback. And did you share already, Trinette? Put up the so
no.
You can see. Wait. Okay, so I'm gonna give her a second to do that sharing. I'm so excited that she's here. We're talking about, quite by accident, we found out that both of us were talking about American Heart Month. Uh-oh, that's me squeaking. Let me be quiet for a moment.
There she is, saying, "Hey, Angie."
If you have me on your phone, I guess my voice is behind.
I'm gonna let her turn hers down so we won't get the feedback. And did you share already, Trinette?
No.
No. Let's see. Okay, so I'm gonna give her a second to do that sharing. I'm so excited that she's here. We're talking about, quite by accident, we found out that both of us were talking about.
Okay, so something that, do you have me on your phone? If I'm on your phone, then that would, no?
If you have me on your phone, I guess
That's my computer.
Let her turn hers down so we can.
Okay. Okay. Well, at the bottom, do you see the mute? Maybe you've pushed the mute at the bottom. That might help.
Okay, so I'm gonna give her a second.
You see under your picture, it should be, there it is. Okay. Okay, so we'll have to do this one at a time since there's a little feedback. But anyway, welcome everyone. Welcome everyone. So excited you're joining us. I'm Angela McGowan, a professional healthcare advocate, caregiver strategist, and my special guest is Trinette Stanford, and she is actually the nurse practitioner and the CEO and founder of Totally Diabetes. And her Facebook page, you can find her by Totally Diabetes as well. So let me just start a little bit. I'm going to begin with the about a little bit about the heart, and then I'm going to let her join in. I think I might go get my earplugs as well if that's what's giving us that kickback. I'll go get that as well. Okay. So anyway, this is February, American Heart Month. Can you hear me at all? You can hear me. Okay, well, just give me a minute. I'll do this and then I'll go on mute and we'll listen to you. I think that might be something that's going on. If you're having a problem with that, let's see how it flows, everybody. Let's get started. So this is American Heart Month. And so, hey, if you don't know, let me tell you, heart disease is the #1 killer of Americans, both men and women. All right, and that translates to about 2,200 people a day. This day, 2,200 people will leave this world because of heart disease and complications from that. And another fact you might not know is that heart disease kills more women per year than all of the female cancers combined. So last year, cervical cancer, uterine cancer, ovarian cancer, breast cancer, all of those, okay, did not amount to the number that left here last year from heart disease. Now, we know we can't do anything about the genetic factors, okay? But 80% of heart disease can be prevented, especially when we're using the ABCs of heart health. So let me talk to you about them. The first one is appropriate aspirin use. So this is, of course, me believing that you're going to your doctor, talking to your doctor if you're having any type of chest pains, whatever it is, and find out if a low dose aspirin could prevent you from having a heart attack. Okay, B, not number B, AB, blood control. Monitor your blood pressure. And if you are currently taking blood pressure meds, please take them as prescribed, okay? I have seen people ate a little too much of something and popped the extra blood pressure pill. That's not the way we take them, okay? C, cholesterol management. Check your cholesterol. Make sure you talk to you about cholesterol with your physician and work to make lifestyle changes. This is not like just going on a diet. This is about the way you're going to eat forever. And the S, because we said ABCs, And this is it. Stop smoking. Call 1-800-QUIT now, okay? Did you know that 80% of all heart disease not only can be prevented, but it's amplified 80% when you smoke? So there's a lot going on, and I'm asking you to follow these ABCs because they are so important, because heart disease is taking people out, as we know, by the thousands every single day. So let me get back to our guests and see if things have calmed down a little bit. Let's see. Okay, it's better. Well, you have to come off the mic.
Okay, I see what was going on. I was trying to feed into my business page, and that's what was happening because I had my people come onto the business page. So
you can share this to your business page. You can just, share it straight to the business page, and if they're in there, they should be able to see it.
Okay.
Yeah, you just now the sharing, you might not can't do it on your tablet. You might have to share what you see, like get on my business page or either Powerful Patient Movement and share it to your business page. You probably can't do it right from the laptop, but you know how you always see me if you look on Angie's Pace or if you go to the Powerful Patient Movement Facebook group, you can definitely share it to your business page. So we're going to give her an opportunity to do that. And while she is sharing it, let me say that we'd love for you to be a part of the Powerful Patient Movement. I'm blessed that Trinette is part of that movement, and you can join it. It's a free membership, bit.ly/Powerful Patient Movement. So I think, were you able to do it going that way?
Yeah.
Okay. And then everyone that's on that page will be able to see it right there on that page.
Well, okay. While it is.
While that's happening, let me just tell you a little bit about Trinette while she's doing that. Okay. She's, as I said, the CEO. She's a nurse practitioner, first of all, CEO and founder of Totally About Diabetes, which is an online self-management education and coaching program for people with diabetes. Isn't that exciting news? Yes, it can be done online. So that takes all of the excuses away that you don't live where she lives, okay? Because everything can be done online, and you and anybody in your family can get help from her. That's the first thing. The next thing is Trinette has been a nurse practitioner for 30 years and certified diabetes educator for 20 years. So she knows what she's talking about when it comes to the healthcare of diabetics. Trinette is a member of the American Academy of Nurse Practitioners, Alabama State Nurses Association, and the American Association of Diabetes Educators. So let's face it, changing mindsets and behaviors takes time, which is why our guest, Trinette, stands out above the rest, because she works with her clients to develop programs that are suited specially for them. So that's called having your program tailor-made. So she's been kind enough to say she would come on with me and talk about not just about diabetes and the heart, but her experience. My grandmother died. She was a diabetic, and they said she died from what they call the silent heart attack, which is prevalent among diabetics. She says that pre-diabetics, those would have been called, where you're pre-diabetic, that your heart trouble's greater. So that's why I really hope that you are sharing it, that you are inviting people, and that you will really listen to this information. I have down that if you want a free consult, it's right here, TrinetteStanford.info, and she'd be glad to schedule some time with you. Okay, Trinette, take it away. It's all you've all shared. Everybody, go for it.
Okay. I can't get my people on, but that's okay. We'll do it later. All right. Thank you, Angie, for inviting me to be here, because healthcare is near and dear to my heart. I have been in healthcare all of my life, and I have always wanted to help people. And diabetes, excuse me, I really got involved in diabetes when I moved to the South. I'm originally from the North, and I was recruited to open up a rural health clinic in the South. And when I came down here, that's when I started seeing so many cases of diabetes, and that's why I decided to specialize in it. And what in years past, when I was in nursing school years and years ago, they would tell us that whenever a woman showed up in the emergency room complaining of chest pain, 9 times out of 10, it was never a heart attack, because women just didn't have heart attacks. You know, they said you need to look at indigestion or anxiety or something like that, but it was not heart attacks. So as time went on and we started seeing more and more mortalities of women from heart attacks, then they, you know, it was like the academia said, well, maybe we need to re-look at this. And the thing is that studies that have been done for heart disease in the past have always been done on men. They weren't done on women. So all of the data and all the information that we had was based on men and not on women. So when a woman presents, and I'm getting a little bit ahead of myself, but anyway, but when a woman presents with symptoms of a heart attack, she may just say, I just don't feel good. Or, you know, I have a backache, or I'm just tired. Those are classic signs. But like I said, I got ahead of myself, but let me go back to the beginning. Okay. Like Angie said, heart disease is the #1 killer of women. And that's tragic. Hypertension or high blood pressure is the first sign of cardiovascular disease. So if you have been diagnosed with high blood pressure and you decided that you're going to do some apple cider vinegar, or you are going to do some kind of remedy that grandma told you about, that is, especially if you're from our community, that's not the right thing to do, because we're predisposed to those health problems, and they need to be addressed and they need to be taken care of. This is not a time for home remedies and home experiments. You need to take your medicine first, okay? And then you can do your apple cider vinegar and everything else after that, but please take your medicine, all right? Also, the other thing that really plays a key role is family history. You need to look at what happened with your mother, your father, grandmother, grandfather. What kind of health history did they have? What kind of health problems did they have? Okay. If they had high blood pressure, if they had a stroke, because stroke goes into coronary artery disease. All of it's the same. It just presents differently. Okay. So if there's any family history of heart attack and stroke.
So Trinette, let me just ask you one question right here.
Yes. I'm listening.
I'm sorry. No, I was just going to ask. I wanted to ask. So when ladies are presenting in the emergency room, maybe they might even be having symptoms of a stroke, and that's why they feel they just don't. They say,
mm-hmm. Yeah, they just don't feel good. So, are you still there? Are we frozen? Angie. Okay. Anyway, I'm going to continue on.
Okay.
But the history of a heart, the symptoms, we can call it.
I'm here.
Okay, there you are. All right. Heart attack is either a blood clot or a piece of plaque that has broken off and has gone into a vessel and has clogged it up. And blood flow cannot get to that area. All right. That is the heart attack. And it gets to that part of the heart. And that's because the heart is not getting the blood flow. That's where the pain comes from. Now, with a stroke, it's still a piece of plaque or a blood clot that has broken off. But instead of it being in the heart, it breaks loose in what we call the carotid artery or the artery in the neck, and it goes to the brain. And it cuts off circulation to part of the brain. So that's why you may hear some of the advertisements says that stroke is a heart attack of the brain, because it's the same basic principle, but it just it has different end organs. So I'm saying all of that to say that stroke and heart attack are all they're all vascular diseases, okay? It just affects different parts. So, like I said, family history, you need to look at what went on with your parents or your grandparents, because what went on with them may go on with you. The other thing is we need to look at risk factors, and we're going to go through those in detail. But risk factors are real. The more risk factors you have, the more likely you are to have an event. All right. So some of the statistics say that 1 in 7 females are smokers. Okay. And that's a risk factor. Also, we talked about high blood pressure. 45% of the population has high blood pressure. All right. So that is a serious problem. Now, we have 2 types of risk factors. We have those that we can change, and we have those that we can't change. We call them modifiable risk factors and non-modifiable risk factors. The modifiable risk factors, those things that we have control over, those things that we can change, they are tobacco use, sedentary lifestyle, weight, sleep, diet, substance use, and stress. Okay, those are the things that we can change. Those are things that's within our control to do something about. Now, the things we cannot change, the non-modifiable risk factors, family history or genetics, your age, gender, your race or ethnic group, your stature, and menopause. Now, those are some things that we cannot do anything about. And like I said earlier, the more risk factors that you have, the higher risk you're at in order to have an acute coronary syndrome. You're more at risk of having a heart attack or a stroke. Now, some populations have more rates of heart attacks than they do of strokes. So any of it is serious, but those things that you can change, we need to work on. Now, when there are some signs and symptoms that we need to pay attention to, some of the problems that we had with women were they would start feeling some kind of way and they would ignore it, saying that, oh, it'll go away. It'll go away. And let me tell you a story. Last year, I started having this severe burning. It was severe heartburn right in the middle of my chest. And I would drink, and I have a history of reflux, I have a history of ulcers. So I started drinking more water and making sure I didn't eat late, made sure that I didn't eat any spicy foods and did things like that. Treating myself, right? Because, hey, I know this stuff. I do it all the time. So then the burning got more severe. So I did what every self-respecting woman did. I came home and I went to bed. And I said, it'll be all right in the morning. And I got up the next day and I exercised in the morning. So I started exercising. and the pain came back and it was severe. And then I said, okay, now I can do like some of these other folks do, not pay attention to it. They can find me dead, or I can take my butt to the hospital. So I called a friend of mine who works in a cardiology office, and I told her what was going on. And she said, pack a bag, come on. And long story short, they admitted me to the hospital. The cardiologist came to see me and took me to the cath lab in order to do a heart cath. Heart cath is the only way that they can, it's the definitive diagnosis in order for them to see what is going on in your heart. Well, thank God my heart was clear. Everything, all my vessels were clear and everything. And the cardiologist came to me and he was surprised. He said, I just knew I was going to put 1 or 2 stents in you. And I said, well, thank you, Jesus. You didn't have to. And it was just, severe. It was spasms. It was severe spasms. So, and that was a case study I wanted you to get the picture of. But there are first signs that occur. We call them prodromal signs. And those signs can occur weeks to months before an acute episode happens. And some of those signs are extreme, unexplained fatigue, something that's out of the blue, just started, difficulty sleeping, shortness of breath, indigestion, like I was having, anxiety, but the last one is just a feeling of doom. You just feel like it's just a feeling of doom. And like I said, those symptoms can occur weeks to months ahead of time. And then the signs and symptoms of an acute episode when you are having a heart attack or when you're having a stroke, you have anxiety. You can have some chest discomfort. I didn't say chest pain, just chest discomfort. And it can be, like, something's not quite right. A cough, dizziness, fatigue, nausea or vomiting, pain in other parts of your body. Like, my back right here doesn't feel good. Rapid or irregular pulse, shortness of breath, sweating, swelling, and weakness. Now, all of those occur at the time of an acute episode. Now, when those things take place, you need to take immediate action. Don't do like this one did, go home and go to bed. It's like, okay, no. The first thing if you think that you're having a heart attack, and I'm back up a little bit, anybody who, I would say in the age of 35 and up, you need to have a bottle of, it can be just a little bottle of plain aspirin, the 325 milligram uncoated aspirin, just the old raw white aspirin. Just have it in your house, okay? It doesn't have to be a big bottle, just a little bottle. Because if you start having any symptoms like that, immediately you take one of those and you chew it, or else put it up under your tongue. I know it tastes nasty, it's horrible, but you know what? It's a lifesaver. Immediately, you put it in your mouth and you chew it, or else put it up on your tongue, let it dissolve. At the same time, be calling 911. No, don't let nobody drive you to the hospital. No, don't get in the car and drive yourself to the hospital, okay? Because things can go south real quickly. And so if you have EMS or an ambulance there, if things go south, they have equipment and everything on board in order to address it. Okay? Don't be having your hubby drive you, because he gonna be nervous anyway, because he don't want nothing to happen to you, because who gonna cook, who gonna clean, who gonna take care of him if anything happened to you. So no, don't put that pressure on anybody in your family. Just call 911. All right. And then you have a 2-hour, don't sit at home and wait. That's the other thing that happens. It's going to go away. No, you only got 2 hours. You have a 2-hour window for them to be able to use a clot buster in the emergency room. All right. So time is of the essence. Don't be playing around. I got to get my clothes ready. I got to iron. I can't go to the hospital looking like it. No, Go any way that you look, that you're looking like, okay? Because if you don't, they may have to do more extensive work. But if you get there within the 2-hour window and everything, all tests come out okay, you can get a clot buster and that can take care of it. Now, the only time that you may have to have any other extensive work, if they find that you have what we call multi-vessel disease, when you have 2 or more vessels occluded or with problems, then that's when they have to do surgery. All right. But that is an extreme case. But those are the things that you do in the event that you have problems. So those are the things that we want to look at. Like I said, the signs and symptoms, and then what to do. Now, the last thing is, okay, how can I prevent this so I don't have to go through all that? Now, that's where we are right now. What can I do in order to improve my profile so I will not have this heart attack or stroke? And what we talk about is decreasing your risk. All right. And Angie touched on it already. Number 1, quit smoking. If you're smoking, quit. And I know it is hard. Believe me, that is the hardest thing I ever had to do. And it was like 30 years ago, but I had a father, my father died of lung cancer. So I had to put it down. But smoking is one of the hardest things to do. Don't want to downplay it, but find some help. There's all kinds of aids out there in order to help you. They got the gum, they got the lozenges, they got the patches, they got all kinds of stuff, okay? Substance use, that's another risk factor. And that's why we've been seeing an upsurge in heart attacks and strokes in younger people because of drug use, illicit drug use. So if you know anybody who's using any drugs, or if you happen to be one of those that's using the drugs, please get some help. Don't be ashamed, because your life is at stake. Get some help in order to stop it. Number 3 is, if you are sedentary, that means if you just sit around, you look at TV all day, you don't do any exercise or anything, you need to get to moving. You need to get up and get moving. Okay, I know you can't get out there and get in a 60-minute aerobics class off the bat, all right? But get up and start strolling. You know, just go for a short walk. You know, even if you can, I live in the country, so if I can walk from my door to the road, that's 100 yards and back. You know, that's how you can start out. And then as you get started and as your tolerance build up, you'll be able to do more. I was reading a story the other day where this lady weighed over 300 pounds. And she said she's heard over 200 times she needs to get moving. She said, but I'm so big, I can't get to moving. So she saw this recumbent bike. And she found somebody who helped her, who got that bike fixed. And she started riding that bike. Well, she's lost over 100 pounds. When she first started, she couldn't go 100 yards. But as she got accustomed to it and everything, she's doing races now with it. So the body's made to move. And if you get it started, it'll keep going. And it'll be to the point where you will enjoy it. You will look forward to it. Okay, the other thing is, if you weight, you know, if your BMI, if you're overweight, you need to lose weight. Now, there are people who are normal weight who have severe heart disease. You know, just because you're skinny doesn't mean that you're healthy. All right. We have a lot of unhealthy skinny people in this world. But if you need to lose weight, lose weight. But avoid those fad diets. Okay? All those fad diets that's out there. And I don't want to step on anybody's toes, but keto and all these other things, no, that is not the way to do it. Because when you lose weight fast like that, it comes back fast. Because once those diets are not made for you to stay on them for life. All right. You need to be on something that you can sustain. That is the weight loss plan. That is the plan that you need to. Thank you, Andrea. Those are things you need to just take your time. If you can lose 2 pounds a week, that is great. Because the thing is, if you keep it up like that and you lose it like that, it will stay off. It will not come back. You lose it fast, it's going to come back fast, and it's going to bring friends with it. All right? Develop healthy sleeping habits. Turn off the TV and go to bed. Do not stay up all night. You say, I'm a night owl. You need to get some sleep. The body needs you to go to sleep. All right? That's how your body heals itself. That's how healing takes place. Your body is resting. So make sure you get adequate sleep. If you're having trouble sleeping, if there's what we call sleep apnea, if you're snoring or having issues with sleeping, if you wake up and you feel just as tired as you did when you went to sleep, you need to talk to your provider about that so they can get you evaluated for a sleep study, because you may need some assistance with that, because a lot of people have died. That's another risk factor. All right. If you have sleep apnea, there are people who have had heart attacks or people who have died because of sleep apnea. All right. So it's nothing to play with. Add heart healthy foods to your diet. Now, I'm not saying eliminate anything, but all things, like I tell my people who have diabetes, there's nothing off limits to you, but you have to limit what you eat. Nothing's off limits, but you need to limit it. You cannot eat certain things at unlimited amounts. All right. 5 vegetables a day. We recommend 5 servings of vegetables a day. And if you round out the rest of it with that, you have a healthy diet. And plus drink water. That's the other thing. Water. People tell you, well, I drink tea. No, I used to argue with my patients all the time. Well, I drink tea, I drink coffee. I said, no, water, plain water. You don't wash your clothes in tea or coffee. You wash them in water. So you have to do the same thing with your body. Okay. Your body needs to get cleansed of all of the waste products and everything. So water is the key. Avoid stress. And as women, that's one big problem that we have. We take on the problems of the world. We will shoulder all kinds of issues. We think we have to do it all. Somebody had posted the other day, talked about, don't let those grown children stress you out. And how many times have you seen that? How many times have you experienced it? How many times have you done it, that you've allowed your grown children to put all kinds of stress on you? All right. What the old saying is, every tub has its own bottom, got to sit on its own bottom. Let grown folk be grown. If they want to be grown, let them be grown. Avoid stress. You don't worry about it. Learn to delegate, learn to let go, and learn to say no. All right. And if women who are menopausal, that will put you at a higher risk factor. Because what happens after menopause, before menopause, you have estrogen, and that kind of protects everything. But then after menopause, the risk factors or the risk of having a heart attack from a woman equals that of a man. So that kind of levels the playing field when women go through menopause. Okay. Check with your provider about low dose aspirin use as a preventive, that you can do it every day. All right. Now, if you have a history of ulcers or something like that, but talk to your provider. Ask them if it's okay if you take an aspirin every day. And I'm talking about those of you who have a family history of heart disease. If you have high blood pressure, if you have issues and you know that those issues are in your family, it's time to be proactive about it. Don't sit back and just allow things or wait for things to happen. This is a time when you can take charge of your health and do better. Eat whole foods. That's another thing. Avoid those highly processed foods. Leave the hamburger helper on the shelf. All right. Stay away from that. In all of those highly processed foods, they contain chemicals and increased sodium. Sodium is one of the bad things that keeps your blood pressure up, that causes problems with your heart and everything else. So you need to eat wholesome foods, or the minimally processed foods. Minimally processed, like, okay, the salad in the bag, that's minimally processed. That's fine to use. Now in the grocery stores, they know people are busy. They know your lifestyle is crazy. So they have started these prepared meals, but they're whole foods, but they've already got them in a kit. So all you have to do is just go home and fix it. And just like the meal delivery, they're whole foods, and you just but they have done the work about the measurements and everything. And all you have to do is put it together and cook it. Cooking at home, that is a great thing to do. I know that's something that a lot of people have gotten away from, but then that way what's in the food. You know what it contains. You control the salt, you control everything else. So I really strongly recommend people cooking at home. And the last thing that I have is take your medicines as prescribed. If your doctor has put you on blood pressure medicine, if he has put you on cholesterol medicine, there is a reason. It's not because he doesn't have nothing else better to do. And especially if you have pre-diabetes, and Angie talked about that earlier. A lot of times people applaud. I say, I don't have diabetes, I just have pre-diabetes. People with pre-diabetes have a high rate of heart attacks and strokes. So if they have told you to take that blood pressure medicine and recommended that cholesterol medicine, please take it, because there are things that's going on in your body under the surface that you cannot see. But because of years of study and everything, we know that these are the things that happen. So we're trying to prevent it. So go ahead and take the medicine. And if you have an issue with those medicines, if you're having adverse effects, if you cannot tolerate it, don't just stop taking it. Talk to your provider. Let them know that, hey, I'm having a problem with this medicine, because there's some substitutes. There's things that they can do, but they cannot treat it if they do not know. All right? It is not a time to be closed mouth. I just ain't going to take it. I ain't going to say nothing to them. No, that is not a good thing. I've had patients that told me that he told me he was on too much medicine, and he said he was going to stop it. And the next thing I know, when I saw him again, he had been in the emergency room and he had 2 stents in his heart. I said, okay, so now are you ready to listen to what I have to say? Yes, ma'am. So, okay. So all of these things are very real, and look at your family. Look at your family history, look at your parents. There are things that you can do. This is the time when you can take charge of your life, okay? Because these are our best years. We're getting older. children are grown, there's things that hopefully there's things that you want to do. There's things that you want to enjoy doing. You know, hey, I don't have to go to work every day. I want to travel. I want to do this. I want to do that. You can't do it if you're sick. You can't do it if you're a cardiac cripple. You can't do it if you've had a massive stroke and you dragging one side. This is time in order to take care of yourself. Okay? Thank you, Angie, for inviting me. If anybody have any questions, I'll be glad to answer them.
Okay, so I've been looking to see, just in case we had questions. So maybe people were just so absorbed like I was. I learned so much. I mean, I know, of course, Andrew is so nice to scribe for us and, doing the 10 things you taught, which we were glad that everybody had a chance to hear it and then see it as well. But I was just quite amazed at how you said having a stroke is just another way of a cardiac, but it just ends up in here. Mm-hmm. It's the same. That was information. And then to think there's some easy things we can do, like you said, and I actually ate one of those prepared whole foods packed dinner kits. I got one and it tasted pretty good. So if you're in a hurry, now you don't even have an excuse about that. Drinking water. Yes. I'm up. See, it's right here. I'm up on the water. Yes. And here's okay. The low dose aspirin. Now that was something different. Remember the ones that are not coated. The ones that are not coated. That is so important. And of course, keeping away from those highly processed food, which is, going to the fast food place. Come on. We think that, we'll just get a burger with just lettuce wrapped around it. We still shouldn't even be in that line. We still wrong. And then let me see, you prepare meals at home. It takes a little time, but guess what? Recovery from a heart attack and a stroke takes even longer. Yes. Than making a meal at home.
Definitely.
And taking your medication. So listen, stop practicing medicine without a license, deciding to take half a pill or doubling up. Let's stop doing that. And here's the main thing. Pre-diabetics, you have a higher risk of heart attack and stroke. If nothing else got you, here we go. Okay. And I know this is a lot of information. You think like, wow, but it's better to hear it now at your home, at your leisure, than listening to it in the hospital bed or in the rehab center, or somebody else is taking all the notes because you can't move. So that's really why I wanted to push about the heart disease, because it is killing Americans, killing people all over the world, but definitely killing us in droves. And when I say us, not just Americans, but minorities, Black Americans, we are doubling up on this. So the reason that it's going down from maybe 55 and 60-year-olds, like you said, having strokes and heart attack, because now those that are using drugs that might be using at an earlier age, okay, they have been brought in. And that's a large number, starting at 35. Wow. But I'm just so glad you were here. Did you want to close us out with anything? I'm going to put your information back up here because it's so important that people do want to, meet with you, that they can actually see. So go ahead if you wanted to say anything else to us, Trinette.
Okay. Like I said, being proactive is so much better than being reactive. All right. And just like I said, we take on we have a lot of stress. We take on a lot of stress because of our families and everything. But let's redirect that. If you're going to take on a project, take on the health of your family. Take on the health of your spouse or your significant other. Take on the health of your children.
Yeah.
And if you see them going down the wrong path, because what is happening now, there are children that's being diagnosed with type 2 diabetes because they're sitting around playing video games and not being active and eating junk food. So
Mhm.
if you have to have a project, let that be a project. When you go to the grocery store, don't be buying those cases of soda or pop. Don't be doing that. Give them some water. I know
That's
water,
right.
milk, fine. But don't bring the soda in the house. Don't bring the pop in the house. Then that way they won't have it. And a lot of times you say, no, I buy juice. You know what? Juice is full of sugar.
Mm-hmm.
Juice is
True.
just as bad. Water
Wow.
or milk. Those can be the two options. Have some family members that from France, and that when you go to their house, they give you water. Those are the two drinks, the water and milk. That's it. And there's nothing the matter with it. It makes it comes from a healthier place. Okay. There are things that we need to do in order to improve our profiles. All right. So
Awesome.
if
Awesome.
anybody needs to talk, there's my contact information where you can get on my calendar, and I'll be glad to give you a 15-minute consultation. And my Facebook page is totally about diabetes, and you can join. It's open. You can go on that, and then if you do have diabetes, be it type 1 or type 2, I do have a special Facebook group, which is Small Changes, Big Results Diabetes. And it's a private Facebook group that you are welcome to join. Okay. All right.
And listen, stop smoking, people. Stop smoking.
Yes.
We don't want you to forget. Stop smoking. On top of all the other things, stop smoking. Okay.
Yes.
Well, Trinette, thank you for coming and giving us this information that is going to save not only our lives, but we can use it to save the lives of our families. So I'm Angela McGowan, your professional healthcare advocate and caregiver strategist. Trinette Stanford here is your nurse practitioner and your diabetic specialist and educator. So between the two of us, you should be pretty healthy, okay, moving forward in 2019. So every time I see you, I say blessings and joy. They both belong to you. Thanks for joining us. Everybody have a great evening. Bye. Okay, well, thank you.